Hi, I'm Samantha, and this is my IM injection. So I'm going to come over, hand hygiene, pull out the patient med drawer, and confirm that I have the correct drawer with the MAR, Mary Smith, date of birth, star, 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 star. So then I am going to check
underneath, having her lift her buttocks for me.
her 2100 drug, the Robenal, and pull that out of the med drawer, the Robenal. Make sure I have the correct drug with the correct MAR. Then I'm going to check the dose, 0.2 milligrams at 2100 route IM for Mary Smith, and check her date of birth, and she has no known allergies. So then I'm going to draw up the med, and I need 0.2 milligrams, and the bottle states it is 0.2 milligrams per ml, so I'm going to be drawing up 1 ml. So I'm going to open my syringe and open my needle. Screw on the lure lock. And I'm going to pull the cap off. And I'm going to draw up 1 ml of air.
Well, I can't touch anything in here until I have my sterile blood.
Right. But this is my idea for before you move it down to make more area.
Honestly, the outside of the box, or the inside is the only thing that has to stay
Oh yeah, so
sterile.
you set the box right here.
That's what I was planning on doing. That's what I was planning on doing.
Also, I don't know if you can inject the tobacco when you put this under your arm or right over.
I'm going to take an alcohol pad and wipe the top of my vial.
Stop because I didn't know
No, you're right.
if it would matter.
I think it does. I'll pull from the top side.
I didn't know that you pushed the pen right on there.
I'm going to put it down and inject this into it and push the air in. I'm going to tip it upside down and using one hand, hold on to it like this, and I'm going to drop 1 ml, making sure not to touch the inside of the plunger. So I want to turn it so I can see exactly how much I'm drawing up. And I'm going to draw slightly past 1 ml.
Also, you're just too tall. I feel like if you end up like this.
Make sure any air bubbles are at the top, and then I can expel them out. And once it looks, oh, we got one on the side there. There we go. Looks like all the air is at the top, so then I'm just going to push it up until I get to my 1 ml mark, until I get liquid coming out of the tip of the needle. So now I'm left with 1 milliliter of the medication and no air. So then I'm going to I'm going to come over and use the scoop method to put the cap of the needle back on. make sure that it's on there, and then I would transport the needle to the patient's room along with the MAR, carrying the needle like this so I make sure not to get any sticks on my way to the patient's room. Once I come into the patient's room, I would set this down, check the patient's wristband against the MAR, and use my 2 identifiers. Hi, I'm Samantha, and I'm going to be your student nurse today, and I'm going to be giving you your Robenal injection. Can you please state your first and last name?
Mary Smith,
Okay, and can you tell me your date of birth?
9684.
Okay, so I compare her name with the MAR and her date of birth from what she verbalized, and they both match. Then once again, I am going to check the MAR for the drug, the dose, all of my 5 rights doing my 3rd check. If coming from a med room with this into the patient's room, I would have placed a piece of tape on it to label it so I know which drug I have here compared to the MAR. So we have the Robenal 0.2 milligrams for 2100. Route is intramuscular. And we have the right patient of Mary Smith. She has no known allergies. So then I would come over to Mary, alcohol the site of the injection. Then I want to give that time to dry so I don't push any of that alcohol in and have it burn the patient. So we'd wait about a minute for that to dry, and once it was dry, I'm going to do my hand hygiene again. Put on my clean gloves. Gonna open and put some gauze here in case I need it for the injection site. Then I'm going to pull off the cap of the needle, making sure to pull it far away from me so I don't stick myself. Pull it like that. Come over to my patient, and if my injection site's here, I'm going to use the D-track for the IM. So I'm going to pull this to the side, stick the needle in, inject the solution, not too slow, not too fast, pull it out, and then release my Z-track. I would then do the scoop method for the needle again and come over and dispose of it in the sharps container. I'm going to take the gauze if necessary and just hold a little light pressure over the injection site, and then place a Band-Aid on it as well. Okay, then I'm going to demonstrate on Lisa how to find the sites for the intramuscular injection. Hi, Lisa.
Hi.
Okay, so for the IM for the deltoid, have you sit up. I'm going to come to the patient and locate off of their clavicle the acromion process. Once I feel that, I'm kind of going to use that for my base of my triangle, and the triangle would come down like this, and then I'm going to give the injection right in the middle of that triangle. Can I have you lay down on your side, please? Straighten your legs out. For this one, I'm going to place the palm of my hand on Lisa's greater trochanter, and once I feel that, I'm going to use my index finger and point towards the anterior superior iliac spine, and then use my middle finger to point over to the iliac crest. Then I'm going to give my injection right in the middle of my 2 fingers there. And then can I have you lay on your back, please, Lisa? Thank you. And for this one, I am going to use my hands to suction the upper part of the leg into 3 sections. And I want to give the injection in the middle towards the outer portion here. So once I section it, I'm just going to use that as a reference, come right over here and give the injection on this outer side here. And that is it for IM.